Hello, my name is Kanisha Neal. I am a lactation educator, a registered dietitian, nutritionist, and a birth doula. Thank you for joining us today for this episode of Mommy Talks. We will be discussing breastfeeding. Thank you for joining us. We gathered questions that were pre submitted all across the Inland Empire online. I wrote down those questions, put them on pieces of paper, and they are here in my handy sound bowl, and I will be randomly answering those questions. Our next question asks, what are the benefits of breastfeeding? Breastfeeding benefits everybody. It benefits the whole of society. But let's talk about the baby first. So it benefits the baby by reducing risk for several things. So things such as asthma, ear infections. It reduces risk of respiratory challenges. It lowers the risk for obesity and diabetes and certain types of cancer. It is also very protective and reduces the risk of developing necrotizing enterocolitis. This is a very life-threatening conditions, particularly that sick babies develop and or babies who are born prematurely. So breastfeeding reduces the risk of developing necrotizing enterocolitis, but it also improves the outcomes for little ones who develop necrotizing enterocolitis. When it comes to the lactating person, so the person who is giving the human milk, so it benefits by reducing risk for obesity, type 2 diabetes, reduces risk for high blood pressure. It reduces the risk for my brain just froze. It reduces the risk for developing things like breast cancer and ovarian cancer. It also helps to burn calories. Some will frame it by saying it helps to lose weight and get back to your pre-pregnancy weight faster, but it really does depend on a lot of factors. So breastfeeding burns calories. In terms of weight loss, there are a lot of factors such as what your food intake is, what your exercise habits are, what your health status is, your DNA, lots of factors, but breastfeeding does burn calories. When it comes to the society as a whole, so breastfed babies, as we just reviewed, have reduced risk for developing certain sicknesses and illnesses and diseases. Same thing for the lactating person. So with that, there is reduced healthcare costs because there is reduced sickness, illness, and disease. So that saves money overall as a society on healthcare expenditures. When it comes to the family unit, breastfeeding saves money. There is a reduced cost. There is lower cost associated with breastfeeding. Now, that is not to say that breastfeeding does not have a cost. Obviously, there's a lot of time and energy that goes into preparing for breastfeeding, maintaining breastfeeding, as well as your support group, your family and your friends and your core circle who are supporting you. All of that time and energy is extremely valuable. And also, obviously, if you are using a breast pump and nursing bras and all of these things, those things do cost money. But in comparison to the cost associated with formula feeding, breastfeeding has a lower cost associated. Next question is about nutrition and breastfeeding. So, how do I eat healthy? If I'm breastfeeding? So another really great question. There are a lot of awesome resources that you can use to assist you with this. So there is, I'm going to read the website so that I don't mess it up. It's wickbreastfeeding.fns.usda.gov. So they have some information on there when it comes to breastfeeding and eating habits. Eatright.org has some information. You have cdph.ca.gov that has resources. So a lot of free resources that you can tap into to get information about nutrition while breastfeeding. But the key thing is to make sure that you have a variety in the foods that you're eating. So so that you are making sure you're eating plenty of fruits and veggies. If you use a traditional plate in your culture when you eat, then you want to make half of that plate fruits and veggies. If you kind of do like soups and hot pots and pho and all of these different ways and bowls to get your nutrition and food in your culture, then you want to make sure that whatever it is that you're eating, that you're having plenty of fruits and vegetables in your food. You want to go for whole grain items. You want to go for things that have a lot of fiber in it. So again, fruits and veggies have fiber in it. If you're eating bread, you want to go for whole grain bread. If you are eating pasta or rice, so pasta, you want to go for a whole grain pasta or brown rice. So just getting as many whole grains as possible when you're eating. You also want to go for lean protein choices. So if you eat chicken, you want to have like the white meat more often than you're having the dark meat. If you are eating beef, you want to go for things that have less fat in it. If you are eating fish, you want to go for the lean fish options. If you are a vegetarian or a vegan, you can do things like tofu. You can have nuts and seeds to help you get protein. And there are different minerals and vitamins and things that you need as well, which is why it's very important to have a variety of different types of foods. You want to make sure that you are drinking plenty of fluids during this time. You have a lot of stuff that you need to replenish, so you want to make sure that you are drinking to your thirst. Make sure you have one of those nice water bottles or a cup of water or something handy to make sure that you are staying hydrated. A lot of families wonder if they need to take supplements, and that's really dependent upon you and your body. If your doctor is recommending a multivitamin based off of a health assessment that they've done for you and your health and what's going on in your life, then you want to go ahead and follow those recommendations. But it is possible to get those vitamins and minerals and nutrients that you need just by having food habits that have a variety. How do I know if breastfeeding is going well? How do I know if my baby is getting enough milk? Thank you so much for asking this question, because when families are feeding directly at the breast, there's always the concern of, I can't see the milk moving. I can't see what the baby is taking in. So how do I know? And there are some very key things that we will look for to see if breastfeeding is going well and if baby is getting enough milk. So the first thing is going to be baby's weight gain and weight progress. So all babies lose weight in the first couple of days. They are losing water weight. They're losing meconium, that black sticky poop. So all babies lose weight in the first couple of days. It is normal. Babies should begin to gain weight. They should start regaining weight as your milk increases in volume. So by 14 days of life, at the 14 days of life, your baby should be back at birth weight or above it. If at 14 days your little one is below birth weight, that is a sign that something is off and we need to seek help. We need to be reaching out to lactation consultants. We need to be reaching out to our doctors, and we need to be having conversations to assess how things are going with breastfeeding. Another thing that you want to look for is diaper output. So there's a saying of what goes in must come out. So you want to look at baby's diaper output. Also will be based on how old the baby is. We're going to talk about in the first couple of days. So for instance, at 2 days of life, baby should be having at least 2 wet diapers. If baby is having less than that, that is a sign that something is off and we need to be having things assessed. We need to partner with a lactation consultant and with our doctors. At day 4 of life, baby should be having at least 4 wet diapers. If baby is having less than that, then we want to be, again, teaming up with the lactation consultant, teaming up with our healthcare provider to make sure we're being assessed to see what is going on with the breastfeeding relationship. And those are just a couple of things that we look for in the baby. But we also want to look for indicators in the lactating person as well. It's not just about the baby's growth and the baby's comfort and the baby's health. It is also about the health and the needs of the person who is providing the breast milk. So if you are breastfeeding and you are in pain in any way, we want to make sure that we are connecting with a lactation consultant, that we are connecting with support groups so we can identify what is going on, what adjustments can be possibly made to assist you and to achieve your comfort. Next question reads, can I still breastfeed if I test positive for COVID-19? So let's talk about a couple of things. What we know is that breastfeeding protects you and your little one from many different diseases. Breastfeeding helps for you and your little one to be healthy. What we also know is that current studies, current research shows that COVID-19 is not transferred through human milk. What we also know is that COVID-19 is transferred through respiratory droplets. So if a person who is COVID positive coughs, sneezes, talks in the direction of other people, those people may breathe it in. It may go on surfaces. That person may touch something and touch their face, and then they get it that way. So that is why the recommendations for preventing the spread of COVID-19 is for us all to wear our face mask, for us to maintain a distance, for us to make sure that we're washing our hands. So there are ways to continue your breastfeeding relationship, your breastfeeding journey by taking precautions. Now, you may have healthcare providers who might suggest that you stay separated from your little one if you are COVID positive, but there are some options for you. I would suggest that you check out a wonderful resource that was that was made by the California Breastfeeding Coalition. It is called Shared Decision Making for Breastfeeding and COVID-19. You can find this resource on californiabreastfeeding.org, and it talks about different options. So if you choose to continue breastfeeding directly at the breast, that you wear your face mask, that you make sure that your hands are clean anytime you're breastfeeding and or taking care of your baby. It talks about the option of expressing your breast milk, pumping it out, and making sure it's available for a loved one to help you take care of your little one. It also talks about in-hospital options, so what you can do directly after you deliver your little one. So there are some options. I would encourage you to check out this resource. Again, it's called Shared Decision Making for Breastfeeding and COVID-19. You can find it on californiabreastfeeding.org. Take that with you to your healthcare providers and talk to them about your options so you can come to a decision that works best for your wants, your needs, you and your baby's health status, as well as the other things that your doctors may be concerned about. All right. And then our last question for this episode is about postpartum depression, perinatal mood disorders, and how that impacts breastfeeding, and if breastfeeding is achievable with dealing with mood disorders and postpartum depression. And the answer is that it is absolutely possible, but it is very important to have a good team of support. So you want to make sure that you as the birthing person, you as the lactating person, that you are going to your postpartum care appointments, that you are being assessed. When it comes to dealing with postpartum depression and having a breastfeeding journey that you are trying to maintain, there is no one size fits all. It really is about individualizing the plan that works for you and your little one. So identifying what the plan of treatment is for you. It's about if there's medications, talking about medications that are compatible with breastfeeding. It's also talking about what makes you feel more at ease and also exploring what things make your symptoms worse. It's also about having your support system of lactation consultants can help you as well with tips on specifically for breastfeeding. But we want to make sure that we have as many healthcare providers and professionals who are involved in your plan of care as possible.